Thank you for attending our training webinar on infection control. We want to make sure that we are all trained on the guidelines of infection control to protect ourselves, protect our residents, staff, and family. Here at ISL, we just want to make sure that you know that the safety and health of our residents, staff, and families is our number one priority. Today, we're going to be covering 4 basic items of infection control. We're going to be covering cough etiquette, personal protective equipment, hand washing, and also hand hygiene. Those are the 4 things that we're going to talk about in this training webinar today. Infection control basics start off with standard precautions. Standard precautions were put in place to help mitigate residents and staff, or us as just human beings, to be exposed to infectious agents in the environment. So these are put in place whether they're known or unknown. We're first going to start off talking about protecting yourself. Just daily, you want to make sure and wash your hands daily with soap and a hand washing agent for 20 seconds or more. A lot of times we like to talk about just doing the birthday song, and that helps out just to get through that process and make sure that you're doing the allotted amount of time when you're washing your hands. And if you are unable to wash your hands, you want to use a preferred hand sanitizer with at least a 60% alcohol base. Avoid touching your eyes, nose, or mouth. You also want to avoid close contact with people who have been sick. If you are sick, you want to stay home. You also want to practice cough etiquette. You want to protect yourself and clean and disinfect surfaces after you're coming in contact with those surfaces. You also want to, we recommend that people that are generally sick or symptomatic to also wear a mask. And those are just some ways that you want to do with standard precautions to protect yourself on a daily basis. We want to also talk about cough etiquette. For cough etiquette, we want to make sure that if we are somewhere, you are within near a person or resident that experiences a cough, you want to make sure and be respectful of one another. And the way that we do that and try to protect each other is, if we have to cough, of course we're going to keep our mask on. You can cough into your elbow, turn your head. You may also want to cough into a tissue or a hanky. And if you do cough into a disposable tissue, make sure that you throw that tissue away and wash your hands for the allotted amount of time of 20 seconds after that you experience that. And once again, if you're not able to do that, make sure that you use a hand sanitizer, the appropriate hand sanitizer. We also want to cover today personal protective equipment. We want to talk about donning and doffing personal protective equipment, and that will be also known as putting on and taking off your personal protective equipment. When you are doing putting on your personal protective equipment, if that is what is necessary, of course you want to first wash your hands. So we're going to always go back to that personal hand hygiene. So you want to make sure that you are washing your hands or using a good alcohol-based sanitizer. So when you talk about personal protective equipment, you're talking about gloves, gown, mask, when you're putting those items on. And you may even also use a face shield or goggles during this COVID experience. When you are in the process of putting on your personal protective equipment, there's a sequence to putting on your equipment. You want to start with putting on the gown first. Okay, the gown needs to cover your arms, your torso, your knees, your back. After you put the gown on, you're going to make sure around the back of your gown to tie the gown and make sure that it's secure. Okay? After you put your gown on, you want to go from your gown and put in your mask or respirator. So if you have a mask, you're going to put the mask on, place it around your ears. If you have a respirator, you're going to put the respirator on, place it around the back of your head or your ears, depending on what kind you have. You want to make sure that the bendable fabric is adhered to your nose. Make sure that you have a good fit on your face. You can always check your mask to make sure it is secure by doing just a simple test. Inhale and exhale. If you feel any air pockets in your mask, then you may need to adjust your mask for a better fit. After you put the mask on, you also want to make sure that you have your goggles or your face shield. You're just going to place those over your eyes, make sure it's secure to your eyes, make sure there's no space in between it with your goggles. And last but not least, you want to put your gloves on. You want to make sure your gloves are on, make sure that your gloves are covering any exposed skin area, and also that they are covered over the gown so that you are completely covered with your PPE. The PPE can get warm, but just think about the safety measures that you are taking while you're wearing this personal protective equipment, okay? You want to make sure that it's secure, and if at any time you have questions about that, here in our building we also have someone, a nurse and our clinical staff, that can always help you out with that, okay? Now, we also have to go through the process when we're talking about personal protective equipment of taking off the equipment effectively and safely. You don't want to take it off haphazardly because you don't want to infect yourself. So the first thing you're going to do is take your gloves off. When you're taking your gloves off, you do have one hand, you're going to use one hand, pull the glove off with the other hand, and you're going to make a ball when you take the glove off so that you can dispose of it, so that you are not touching any of your exposed skin, that the glove is all in one contained ball when you dispose of it. After you take your gloves off, you're going to make sure that you sanitize or wash your hands. Then you want to take off your goggles. As to not touch your face or eyes, take your goggles off. After your goggles are removed, you're going to go behind your neck, untie your gown, pull it back from around you, and remove your gown also as well. And last but not least, of the 4 items that you put on during this PPE experience, you're going to remove your mask or your respirator. Take the mask off, whether it's looped behind your ears or over your head, remove the mask, throw it into the appropriate waste receptacle, and wash your hands. And that's how you don and doff your personal protective equipment. Okay? We also want to just make sure that during this time with infection control that you are following all safety guidelines as well. We just want to make sure that during this time period, that while we're learning about infection control, that we're using safe practices, that we are keeping our hands away from our face, that we're limiting the surfaces that we touch, that we change our gloves that are torn or heavily contaminated, and that we are also performing hand hygiene. Now that we have covered personal protective equipment and the infection control basics, we also just want to remind you that social distancing can save lives. We want to make sure that if you are in a grocery store or if you're on a visit, that you maintain that 6-foot distance. We just want to make sure you're keeping yourself safe and healthy. And in conclusion to our training about PPE, hand hygiene, gloves, and also cough etiquette, we just want to make sure that you are staying safe. Okay? And if you have any questions, all the information that we discussed during this training is on the CDC website. We also will be posting the link to that website. There's also a video posted that goes over to review the donning and doffing, or also known as the putting on or taking off the personal protective equipment. We thank you and we look forward to seeing you soon.